Well, cardiac rehab is the last step in a patient's journey when recovering from heart problems. And today, we're learning about the benefits of it as we recognize February as American Heart Month.
Carmen Taffy's with us here in the studio to share more about that month. Morning, Carmen.
Good morning, Rob. So if you have a heart attack or other heart problems, cardiac rehabilitation is an important part of your recovery. It can both help a person recover from heart problems and prevent future heart problems. According to the Centers for Disease Control and Prevention, about 800,000 people in the United States have a heart attack every year. Cardiac rehabilitation not only can help a person recover from heart problems, but can also prevent future heart problems. The Rapides Regional Medical Center's Cardiac and Pulmonary Rehab Facility has seen through medical research that the mortality rate is reduced by 30% if the person does participate in cardiac rehab. The cardiac rehab program is 36 sessions long. There is a team of exercise and nutrition specialists, physical therapists, and counselors that will help you every step of the way. Program coordinator Tina Greer breaks down the benefits of cardiac rehab.
During the exercise, they're increasing their stamina, their endurance, their muscle strength, because we do incorporate weight training along with our aerobic exercise. And that also helps to increase their balance, because we're improving their balance and we're improving the posture, which reduces falls of that individual, and they're able to gain their independency back. Because a lot of time after bypass surgery, that individual has to have assistance from family or from other medical staff. But over time in cardiac rehab, that individual is able to start getting their daily activities back again.
After completing 36 sessions, you have the option of entering the wellness program, and the facility sees a 98% retention of patients continuing their rehabilitation.